Hi there, I'm Shelly Paulson, physical therapist and registered yoga teacher, and today I'm going to talk to you a little bit about osteoporosis. Osteoporosis is a disease that causes bones to be brittle and at risk for fractures. It literally means porous bone. If you think about our bone tissue, throughout our lifespan, we are constantly naturally rebuilding that bone tissue, tearing it down, building it back up. It's just what our body does. However, after the age of 40, we start disposing of more bone than we add, and the result is a decrease in bone density. So one of the biggest things you can do to minimize your risk for fractures is exercise. Now, when you get to be a certain age, your doctor will probably recommend that you have a bone density test, and they can let you know by this if you're at risk for osteoporosis or if you have osteopenia, which is kind of the start of it. More of a decrease in bone density, but not to the point where you have osteoporosis. So if your doctor alerts you that you do have osteoporosis, it's good to know if you have severe damage or if you have mild risk. Either way, it kind of affects your exercise program. So if you do, you kind of want to talk to your doctor about exercise. You want to get cleared for that. But some of the biggest things you can do are weight-bearing exercises. So weight-bearing exercise basically just means exercise that you do on your feet because you're working against gravity, which helps your muscles and bones build up. So what are some examples? Well, there's low impact exercise, and that can be like a low impact aerobics, walking, definitely walking. Walking is one of the best exercises you can do. You could go on an elliptical. That's considered a low impact weight bearing exercise. There's some moderate weight-bearing exercises. That would be things like climbing stairs, dancing, hiking maybe, so you're getting some elevation. And then there's some high-impact exercise, and that would be things like jumping around, so jumping rope, playing different types of ball like basketball, step aerobics, different sports, racket sports, things that you're jumping, running, changing directions, those are considered high-impact sports. And if you have been told you have osteoporosis and you're pretty severely affected, I would avoid high-impact sports and activities. That can increase your risk for fracture, as can certain movements. So if you're doing a lot of bending and twisting, yoga could be great for someone with osteoporosis, but you also have to have some considerations. You want to avoid some of those twisting and extensive bending positions. Now, that being said, if you are somebody who's pretty fit and active and you've been doing a certain activity your whole life, even if you do have osteoporosis, you can discuss it with a therapist or your doctor and they can recommend certain activities. You may still be able to do them. So, what are some other things you can do? Well, if you have osteoporosis, you want to make sure you're getting a good intake of calcium, vitamin D, and protein through your diet. Drink plenty of fluids, get lots of rest, because you want your body to be able to build back those tissues naturally. And if you need to, you can always talk to your doctor about supplementation or medications. Either way, exercise is always a great option, and we are here to help you with that.